We are a child mental health agency. We serve children ages 3 up to ages of 18. Our program has an outpatient clinic. It also does medication management for children with mental health issues. We have level 3 residential, level 2 residential for sexually reactive or problem sexual behavior male youth. We run child and adolescent day treatments that serve ages kindergarten through 12th grade. And we're very passionate about what we do. We have grown from 36 employees to 90. And I do not think that would have been possible without Patagonia Health.
In the beginning, I was really intimidated with the electronic medical records, and I actually tried to fight it.
One of the reasons that I wanted to get on the system was first to bring us into the 21st century and try to have things more integrated. Because we have a host of different services, we wanted to make sure that those services were able to speak to one another.
I was terrified of the transition, but once we started, it was the best transition and the smoothest transition. It's so much faster. It was constant paperwork, just felt like I was constantly buried in paperwork to have to file. And now I just scan it and shred it.
Once we went with Patagonia Health, we went all paperless.
Once you learn the system, it was actually pretty quick to learn. Then it's great. I would not want to go back to charts, never.
They did many trainings for our staff around how the medical records person would use them, how our reimbursement officers would use them when it came time to do the billing, and how it would integrate from the ESB into creating 837s and 835s, which is their lingo for denials, remittance advices. It was a process that we chose to take, and we rolled it out by service.
And it has all the comprehensive sections for your assessment, your mental status exam, your medication management, your impressions, your plan. So all the components are there. It was ready to go, at least for me. There was nothing that I needed to do to alter the template. And then the medication management piece has been great because it reduces the margin for errors. Handwriting prescriptions with pharmacy interpretations of prescriptions, and it helps our documentation because we have a solid record there of prescriptions. So now with the e-prescribing, I think it allows for a lot of flexibility.
Patagonia Health helps us. We can all access the same information as soon as it's scanned in. We don't have to search through paper files. It's super convenient.
I use Patagonia Health every day. I use it for going into check notes that the staff writes on each child so we know what their behaviors were each day. I go in and I send those notes to billing.
With Patagonia Health, we have also got a lot more claims paid. We have probably went from 20% denials down to almost none. Sometimes we have no denials with the MCOs. Before we purchased Patagonia Health, usually our claims had about a 30 to 45 day turnaround. So if your claims were denied, you sat there waiting until you got a denied letter back in the mail, and then you had to rebill it. Today, it will show me within 8 hours if it is denied. I can go in and rebill it that same day and know within 8 hours if it's approved.
There is a documentation that's required by all the insurance companies called meaningful use. It can be a cumbersome process, but I have to say that with Patagonia Health, they've made it much more friendly to use. They also give me feedback after every client visit on what was documented well to meet the standards and what was missed to help my performance next time. I really appreciate that component about Patagonia Health as well.
We use Patagonia Health in the group homes. We're assigned to a client, sometimes 3 to 4 clients at a time. And at the end of every shift, we have to go in and pretty much review our day in order to send to the Medicaid and stuff. And we can do that straight through Patagonia Health. And we don't have to handwrite anything. If there's an issue, our supervisor can just assign it back to us and we can fix it immediately. Just the changes that we need to make are super quick. Rather than having to redo the entire note, we can just go in and edit what needs to be fixed or added.
Generally, it just allows us to document full comprehensive assessment that could be passed on to other professionals, and they'll get a better understanding of what the child is going through.
It tells me for any new prescription that I prescribe about the drug-drug interactions of the client's medication profile, about what they're already on, and whether it's a mild, moderate, or severe interaction, and what exactly that interaction is. That's a most helpful clinical component about the e-prescribing.
Prior to having an EMR, we actually did a lot of paper, and notes were very difficult. I mean, we would have to track them down, and not just calling on the phone, but sometimes we'd have to manually, go drive over, pick them up. It was just more difficult to track notes, which is how Medicaid reimburses, by your event note. Now, with having an EMR, it's much more conducive to a good working environment. We can actually work together more cohesively, and it's definitely more integrated.
Where my medical records room was like a huge room to store all these charts, I'm down to a 4-drawer lateral, and it makes it much easier than them having to come to this main office like they used to pull a client's chart. So this makes it much faster and much easier. And then if they have something that needs to go into Patagonia Health, they can scan it to me through email, and I can take it straight from the email and put it into Patagonia Health, and it's right there very quick.
Patagonia's made my job better because all the information is easily accessible. So if you have a new client, you can go in and find out all the information that you need about them in Patagonia.
It's been the best, the fastest, and the best. So much user-friendly than what it used to be.
I don't know what I'd do without Patagonia Health.